So, how does CDC figure in numbers that haven't been officially reported? Related to this, there's a large amount of home testing going on. So, how does that affect the testing data and what CDC is able to report on COVID data tracker, for example? Captain Ritchie?
Sure. No, thank you, Haley. So really important question. It's something that we've definitely been, exploring more and pushing into further. So I guess first from a self-test data perspective, I mean, self-tests really, the main value of those is for a risk reduction tool, so as it can inform individuals' actions to keep themselves and others safe. So it's really at the end of the day, am I positive or negative based off self-test, and what should I do about that to protect others? And really, we have no way of no authority in mandating reporting of those data, but we do know that they're out there, and we want to make sure that we do, take them into account as we're thinking about, incidents of disease and that sort of thing. One of the things that I think as we push into the space and think more about it is that, we have a host of other data. I walked through a lot of them, other testing data, and we're still getting millions of test results, a day and a week. For PCR tests and things of that nature. And then we have robust other systems, whether it's case reporting, wastewater surveillance, hospital surveillance, to really understand and monitor kind of the trends that are going on across the country. So while yes, we may have a little bit less visibility on some of the self-test results, we have a host of other assets in play that we can leverage to make sure that we have a good situational awareness of what's going on. That being said, we've also been working with our partners, both at the federal government level and also our state, and also the manufacturers of self-tests, to kind of continue to understand these self-test data and how they potentially can be used to augment our other surveillance that's already going on. For now, for the COVID response, as well as into the future, because in the future, as we've established some of these pipelines to bring in data on self-tests, we see that there's really applicability down the road as far as how to best leverage these to help really inform what's going on at the national level, as well as maybe even more importantly at a local level. So yes, we might not have all the complete data on self-tests. We feel like the amount of other robust information that we're getting in, we're maintaining strong situational awareness.